The last class we saw about the cerebellum, and we were seeing the nuclei in the cerebellum, which was represented here in this. Each side we had 4 nuclei: lateral to medial, dentate nucleus, emboliform nucleus, globose nucleus, then the vestigial nucleus. These were the 4 nuclei on one side. Okay, so this is what we saw in the last class. Now let's see cerebellar peduncles. Now what is cerebellar peduncle? We have already seen that cerebellar peduncle. There are 3 cerebellar peduncles. They are superior, middle, and inferior cerebellar peduncle, which can be seen from here. Superior cerebellar peduncle. Right. Now the middle cerebellar peduncle can be seen, this one, which is cut here. Then the inferior cerebellar peduncle. The orientation may be a little different, but you can definitely see the 3 cerebellar peduncles. So the brainstem is connected to the cerebellum through the cerebellar peduncle. So the brainstem consists of 3 parts: midbrain, pons, medulla. The midbrain, pons, and medulla. These are the 3 parts of midbrain from superior to inferior. So the midbrain is connected to the cerebellum through superior cerebellar peduncle. Pons, which is located at the middle, that is connected to the cerebellum through middle cerebellar peduncle. Here you cannot see that because it is cut here. Then the lower part, that is medulla oblongata, that is connected to the cerebellum through inferior cerebellar peduncle. So these are the 3 cerebellar peduncle which are connected to the cerebellum. The cerebellum is linked to other parts of the central nervous system by numerous efferent and afferent fibers. Now in this cerebellar peduncles, you can see the fibers. Okay, these fibers can be going from the cerebellum or fibers that are coming into the cerebellum. So this can be termed as afferent and efferent. Whichever fibers that are coming into the cerebellum, they are called as afferent fibers. Whichever fibers these are leaving the cerebellum, they are called as efferent fibers. Efferent means E. I meant E. Okay, afferent A. Okay, so afferent means that is coming to the cerebellum. Efferent means that is going from the cerebellum. So this is what you can see in the peduncles usually. And the fibers such as efferent and afferent fibers that are grouped together on each side into 3 large bundles or peduncles. So when I say peduncles, they are nothing but the fibers. These fibers can be of afferent, that is coming to the cerebellum, efferent, or that is leaving from the cerebellum. So this can have 2 possibilities. The peduncles have 2 possibilities: the afferent fibers or the efferent fibers. So that is the meaning of it. The superior cerebellar peduncle connect cerebellum to the midbrain. This is what we just described. Middle cerebellar peduncle connecting the pons to the cerebellum, and the inferior one that is connecting the cerebellum to the medulla oblongata. So this is what we saw. Now let's come to the next topic, or we will just begin with this topic. We are not going to go detail at this, but we will be seeing this in detail very soon. The ventricles of the brain. I was talking about the ventricles from long time, from that time, like when we started the central nervous system, that I mentioned that central nervous system is developed from the neural tube. Neural tube had a cavity inside. That cavity, transforms into the ventricle, because the neural tube is going to give rise to the brain and the spinal cord, right? So the cavity remains inside, but the cavity's shape is going to change, and this is the shape ultimately. You can see that the cavity is present throughout in this area, and they are called as lateral ventricle. You can see here lateral ventricle. This is the lateral ventricle. This whole thing is lateral ventricle. Can be seen on either side. That is a cavity of telencephalon. Telencephalon is going to form the cerebral hemisphere. Now you can go back and read embryology of the nervous system. You can understand what is telencephalon. Third ventricle is a area, or it is a cavity that is between the diencephalon. Diencephalon is going to give rise to thalamus, hypothalamus, metathalamus, epithalamus, and so on. Okay. Then this already. The cerebral aqueduct. This is a cavity of mesencephalon. Mesencephalon is going to give rise to midbrain, which we saw already, midbrain. Then the fourth ventricle, which is the cavity of rhombencephalon. Okay, rhombencephalon or the hindbrain. Okay, hindbrain. It consists of pons medulla. Okay, and the cerebellum. Okay, in between that you can see the fourth ventricle. So the cavity here, the ventricles here can be named into different areas or different names, as you can see here. The cavity of the telencephalon, cerebral hemisphere, is called lateral ventricle, which is in this shape, right? The cavity of the diencephalon, that is third ventricle. So remember, diencephalon is going to give rise to thalamus, hypothalamus, metathalamus, and so on. Cerebral aqueduct is the cavity of mesencephalon or the midbrain, and the cavity of the hindbrain, that is fourth ventricle. So hindbrain is nothing but the pons medulla and the cerebellum together called as hindbrain. So that's the cavity inside that is fourth ventricle. Now remember, all these cavities are connected with each other, as you can see there, right? And ultimately the fourth ventricle is going to move downwards as the cavity of the spinal cord, that is called central canal, that you might be knowing now. Yeah, I think we are going little detail, not much, but still, yeah, let's talk about the fourth ventricle. So fourth ventricle is this one, right? This is the fourth ventricle. It's a cavity that is seen between pons, medulla, and the cerebellum. Here you can see this is a sagittal section. This is a section, or you can say it's a view from the posterior aspect after the cerebellum is removed. So you can see the posterior aspect of the pons and the medulla oblongata. So what you see here is the floor of the fourth ventricle, and the roof of the fourth ventricle is the cerebellum. As you can see here, this is the floor formed by pons and the medulla, and this is the roof. Roof is by the cerebellum. Now we have to cut the cerebellum to see the fourth ventricle. So in this picture you can see the cerebellum is cut from one side and both sides, right? It's cut from this side. You can see almost half of the cerebellum is cut to show the floor of fourth ventricle. The fourth ventricle is lying dorsal to pons. So it is lying posterior to the pons and medulla, right? And it is anterior to the cerebellum. So that is location. It is a tent-shaped structure. Okay, roof makes it more spacious. So tent-shaped roof. Actually, the roof, if you can see the roof, it is like a tent. So that makes it more spacious. The cavity of the hindbrain, which is pons, medulla, and the cerebellum, is called fourth ventricle. This is what we just saw. Okay. So we have the fourth ventricle, which is present posterior to the pons, medulla, anterior to the cerebellum. The tent-shaped structure, the diamond-shaped structure is, as you can see here, right? That is making it more spacious. And the cavity of the hindbrain, that is pons, medulla, and cerebellum, is called fourth ventricle. What are the communications of the fourth ventricle? So superiorly, the fourth ventricle is connected to the third ventricle. This is the third ventricle. This is the lateral ventricle. So here, the fourth ventricle is connected to the third ventricle through cerebral aqueduct. So cerebral aqueduct is connecting fourth ventricle to the third ventricle. Inferiorly, it is continuous with the central canal of medulla. So the fourth ventricle tapers down as the canal of the medulla initially, then it is going to continue as the canal of spinal cord. So the fourth ventricle communications are superiorly, it is connected to the third ventricle through cerebral aqueduct. Inferiorly, it is connected, or inferiorly it is going to continue as the canal of medulla, then the canal of spinal cord. So this is a continuation of the, or you can say, communications of the fourth ventricle. You can see that generally all the ventricles are connected with each other. So these are the other diagrams. This you might be giving little concentration on this area, otherwise you will not understand. So please listen to me properly. So this is the lateral ventricle. You can see that here, right? Yeah. And you can see the third ventricle here, right? And you can see the fourth ventricle, the cerebral aqueduct connecting the third ventricle to the fourth ventricle. Yes, that you can see. This is one picture. This is a diagrammatic representation. You can see the cerebellum also in this area. When you look at properly, you can see that this is the fourth ventricle has got some roof here. As you can see here, this is a roof which is formed by the cerebellum, and you can see that on either side of the cerebellum, you can see that there is a horn. There's a projection that you can see here, right? There's a projection. This can be seen on either side. Now you can see the left side. this projection. Similarly, you can expect the other side also. Okay, there is something like there is projection. Fine. Now here in this, we are seeing this is the same picture which we saw now. That is, the floor of the fourth ventricle. But definitely, when you see the lateral aspect, you can see that the fourth ventricle is extending laterally. No, it is extending laterally. All right, that is towards the cerebellum, on the sides of the cerebellum. This side, this point. Similarly, this here in this area, you cannot see very well here, but to this area, it is extending laterally. So in fact, you can see that there is an extension of the fourth ventricle laterally. That is what you can see here in this. It's a diagrammatic representation. So you can see the extension of the fourth ventricle. So fourth ventricle here is extending laterally. That's what you can make out from this. Okay. Now we will talk about this in more detail, but I just told you that this is an extension. Fine. Now this is another diagram. Okay, another diagram here. You can see sagittal section where you can see that the pons medulla cerebellum. Between pons medulla cerebellum, you can see the fourth ventricle, right, which is present. Right. Fine. Now we know that the brain, right, the central nervous system, is covered by meninges. There are three meninges: dura mater, arachnoid mater, and the pia mater. It is from outside to inside. Dura, arachnoid, pia. And we know that there is something called subarachnoid space. Now, what is subarachnoid space? Subarachnoid space is a space that is lying deep to the arachnoid mater. Okay, so in other words, you can say subarachnoid space is in between arachnoid mater and the pia mater. So in between arachnoid mater and the pia mater, subarachnoid, right? Sub means below the arachnoid. So below the arachnoid and between the pia mater, right? So this, not between the pia mater, below the arachnoid and pia mater, right? Between that, between the pia mater and the arachnoid mater, you can see space, that is subarachnoid space. Now, what is in the subarachnoid space? Subarachnoid space is usually filled with cerebrospinal fluid. We shortly call it as CSF. Now, how the CSF is reaching the subarachnoid space? That is what we are going to see now. Okay, it's very important. Please make sure that you are understanding. If you're not understanding, please ask me. Now, let me tell you here this thing. Okay, here you can see the section, right? You can see the cerebellum, and here in this area, you can see that this structure, what is shown here, is the arachnoid matter. The arachnoid matter. This black color line, that is arachnoid matter. Okay. Then on the outer side, there is a dura mater, right? Dura mater. That is not seen in this, but you can expect there is a dura mater. Then we have the arachnoid. So arachnoid matter is this one. This black line, what is shown here is arachnoid matter. Now, deep to the arachnoid matter, you can see this red color line. This red color line, which is over the cerebellum, represents the pia mater. This red color line shows the pia mater. Now, between the pia mater, no, pia mater you cannot separate it from the cerebellum. Now we are seeing the cerebellum. Okay, so I'm talking about the cerebellum now. So the pia mater of the cerebellum you cannot separate, but you can see there is a separation between the pia mater and the arachnoid matter, right? That space is shown in this. It's blackened here, darkened, right? Darkened area here is the space between pia mater and the arachnoid matter, and this space is called subarachnoid space. Subarachnoid space. So here it is not ending. Okay, it is continuing. It is continuing, but we are not showing it. That's why. Okay, it is continuing here, but it is not represented. That's it. Okay, but look at this space here, that is between pia mater and the arachnoid matter. That space is called subarachnoid space. Look at the subarachnoid space, how it is running, right? It is now, it is there in between here in this area, right? You can see that. Now, when you look at this, you can see that the fourth ventricle is having an aperture or opening, and that opening is at the roof of the fourth ventricle. Now, this roof has a communication to the subarachnoid space, right? And the fourth ventricle is the place, or the ventricle is the area where the cerebrospinal fluid is produced, and that is produced by this structure that's called choroid plexus. choroid plexus. Now, what is choroid plexus? Choroid plexus is actually contains blood vessels, some of the blood vessels. Also, the ependymal layer. Ependymal layer. Ependymal layer is a lining epithelium that is seen in the ventricle. So inside the ventricle there is a lining epithelium that is called ependyma. Anyway, no need to think about much about the ependyma, but remember that choroid plexus is the one which is going to produce the cerebrospinal fluid. Now this is producing the fluid. That fluid is filling in this area. Now the fluid can easily come to this area, subarachnoid space. Now remember, when I talk about the subarachnoid space is not ending here. It is ending throughout the brain, throughout the central nervous system, isn't it? Because throughout that you have the dura mater, you have the arachnoid mater, you have the pia mater. Between the arachnoid and the pia mater, you have the subarachnoid space. So this can be seen over the cerebellum. Now if you see, it is going to be seen on the brain also. So around the brain you have subarachnoid space, right? Around the cerebellum you have subarachnoid space. Around the brainstem we have the subarachnoid space. You can see here. See here, this is the subarachnoid space again anteriorly. So you have to imagine that. Okay, right? You have to imagine in that way that it is covering throughout. This is sagittal section, so I cannot make it possible to draw that. But you can see that the anterior aspect also you have the subarachnoid space. Now here we are talking about the communication of the fourth ventricle. And why we are talking about that? Because we should know that how the cerebrospinal fluid is entering into the subarachnoid space. That means the fourth ventricle has got a communication with the subarachnoid space. How? There are two ways. Okay, two ways. One is here at the roof. There's a connection. Again, there is another connection. Or there are connections. I can show you here. This is the extension that I mentioned, right? This extension. At the tip of this extension, there is a foramen. And this foramen is also connected to the subarachnoid space laterally. So this is left side. Similarly, on the right side, you have another foramen. There it is connected to the right subarachnoid space, because subarachnoid space is seen throughout, right? Yeah. So dorsally in the lower part of the roof, there is a median aperture that's called foramen of Megendi. This is named, that's called foramen of Megendi. Through this aperture, ventricle communicates with subarachnoid space. So this area, subarachnoid space. So usually subarachnoid space is very minimal. In fact, you can see that. Okay, the space is very minimal. But when you look at this area, where the arachnoid matter is reflecting from the cerebellum onto the posterior aspect of the medulla, this area, what happens here is that there is an area which is very big. The subarachnoid space here is very big, and that is called cisterna magna. Cisterna magna. The cisterna is nothing but, I can define cisterna as, they are the enlarged subarachnoid space. They are the enlarged subarachnoid space. So in some areas we can see cisterns or cisterna. Okay, you can see that. But among that, this is the largest one. That's called cisterna magna. Magna means big, right? So this is the cisterna magna, where the fourth ventricle is connected or opening, and this foramen is called foramen of Megendi. Remember that, foramen of Megendi. It is unpaired structure which is seen on the roof, whereas on either side, again it communicates with subarachnoid space through the lateral aperture, and the lateral aperture here is called foramen of Lashka. So foramen of Lashka, there are two, right and left side, whereas foramen of Megendi, it is single. So this is very important to understand how it is connected to the subarachnoid space. Okay, how the fourth ventricle is connected, because the ventricles are going to produce the CSF, and CSF has to circulate in the subarachnoid space. So just imagine that your brain is actually floating in the subarachnoid space or in the cerebrospinal fluid. So brain is inside a pool, inside a pool which is made of cerebrospinal fluid. It is floating actually. Brain is floating, right? Yes. Now, a little bit about the floor of the fourth ventricle. This you might be feeling little difficulty, but try to understand some things, not all. You may not get everything what I'm going to say, but if you get something, then that's good. Yeah, at the center. So here, this is the area we are going to represent, or we are going to explain. You can see here this area. Only this is the diagrammatic representation. This is the actual picture that you can see. Now, you might be knowing many things now. That first of all, let me talk about the medulla. When we talk the medulla, or when we talk about the spinal cord, the posterior aspect of the spinal cord, we were talking about septum, right? Posterior median septum, right? And the posterior median septum, when you see the medulla, this is the dorsal aspect, right? Posterior aspect, right? So posterior aspect, you mention it as posterior median septum of the medulla oblongata also. Whereas when you come to the floor of the fourth ventricle, this is called something else, and that's called median sulcus. Median sulcus, which is passing at the center, or which is dividing the floor of the fourth ventricle into two halves, equal halves. Okay, remember this is the posterior aspect, right? Then what can you see? Other things. You might have studied all these things, but right now I don't know whether you can remember. But let me make it more simpler way. Okay, yeah. So this one here, no, let's talk about this one. There's a line which is extending from the lateral side. Okay, right. So there's a median sulcus. On either side of the median sulcus, there is a line which is extending from upper aspect that goes down, goes medially and attached to the median sulcus in this way. And this line is called sulcus limitans. Sulcus limitans can be seen on either side, right? Sulcus limitans. So here you can see median sulcus. This is sulcus limitans. Sulcus limitans, right? That can be seen. Now, when you look at closely, you can see that there is an elevation here. There's an elevation in this area, and this area. There's an elevation, right? This elevation, and this elevation is called medial eminence. Medial eminence. So this projection is called medial eminence. When you look at the median eminence, somewhere here in the lower aspect, or you can say middle, right? Almost in the middle, right here in this area. There's another projection that here is not very clear, but it is there in this area. That's called facial colliculus. Facial colliculus. Now, what do you mean by facial colliculus? Now, remember, we are talking about the brainstem, right? Brainstem has got nuclei. Now, here, if you remember the facial nerve, right? I was mentioning about the facial nerve and the abducens nerve nuclei. Facial nerve nuclei and abducens nerve nuclei. If you remember that picture, you might be, I don't know whether you remember it, but still, the facial nerve actually winds around the abducens nerve nuclei. Facial nerve, after emerging from the nuclei, that winds around the abducens nuclei, and because of that, there's a projection, and that projection is called facial colliculus. Facial colliculus. You can go back and read that topic. Maybe I might have told about those things when I was talking about the section of the medulla. Okay, so since the facial nerve is winding around the abducens nerve nuclei, it produces a swelling. That's called facial colliculus. Fine. Anyway, now this structure here, this structure is called superior cerebellar peduncle. Superior cerebellar peduncle is actually connecting the midbrain to the cerebellum. Midbrain to the cerebellum. So here you can see this is the superior cerebellar peduncle. This one. So it's represented here in this way. Now, if you look at carefully, you can see that there is a there's a line that is connecting from the sulcus limitans to the superior cerebellar peduncle. Look at the sulcus intermedius. Sulcus limitans. Sulcus limitans is starting from the superior cerebellar peduncle, isn't it? It goes down. But you can see there is another line that is attached to the superior cerebellar peduncle that is extending from sulcus limitans, and this line makes a triangular area here that's called superior fovea. Superior fovea. So this one is superior fovea. Here you can see that superior fovea, right? And just above that, you can see another area, upper aspect. That area is called locus coeruleus. Locus coeruleus. Coming to the lower aspect, here there's a line that is called stria medullaris. Here you can see that stria medullaris, which is actually limiting the separation, or it is separating, or this line you can say that the presence of line demarcates the pons and the medulla oblongata. So this is above this we have the pons, below this you have the medulla oblongata. So stria medullaris can be seen. These are representing some fibers. Okay, stria medullaris. Coming to the lower aspect, Here you can see that this structure is called inferior cerebellar peduncle. The whole structure is inferior cerebellar peduncle. All right, cannot be seen in this very clearly. Yeah, this area inferior cerebellar peduncle, but here you can see definitely inferior cerebellar peduncle. Now, remember again the median sulcus and the sulcus limitans, right? You can see how it is joining. Now, if you look at the lower aspect, you can see that there's a line extending from the sulcus limitans and that goes and attached to the inferior cerebellar peduncle. Here, similarly, you can see this one, right? And from there, another line extends from both sides, right? From here, it extends downwards. From here, it extends, this one, it extends downwards. This you can see. Now, because of these lines, it divides this area into two parts. The upper part here is called vagal triangle, where you can see the vagus nerve nucleus is present. Okay. Whereas below this dotted line, this area is called area postrema. Area postrema. Area postrema is called vomiting center. There is something called blood-brain barrier, which could be seen throughout the brain. Blood-brain barrier. What does that mean? That means that the content of the blood, whatever is there in the blood, some of the chemicals will not be transmitted or will not be transferred into the brain. That has been prevented by blood-brain barrier. Blood-brain barrier is present, okay, generally throughout the brain. Okay, that does not allow some chemicals to enter into the brain. But the area postrema is not having blood-brain barrier. So this is also called vomiting center. Okay, area postrema. Anyway, this line that I represent here, which is a dotted line, is called funiculus separations. Funiculus separations. Okay. Now, when you look at the lower aspect of the funiculus separations, this area where you can see the inferior cerebellar peduncle is meeting at the center, this is called obex of the medulla oblongata. So this could be seen in this area. Now, again, coming to this area, you have seen the area postrema. You have seen the vagal triangle, where you can see the nucleus of the vagus nerve, that is dorsal nucleus of vagus. And this area, upper part, is called hypoglossal triangle. It is called hypoglossal triangle because this area, you have the nucleus of the hypoglossal nerve. Okay, so that is present here. So if you look at this area, you can see that hypoglossal triangle, right? This area. I'm sorry, this is a hypoglossal triangle. Yeah, here it is. I'm sorry. Hypoglossal triangle, upper part. Lower part, you can see the vagal triangle. So hypoglossal triangle, vagal triangle can be seen, right? Yeah. I think that will be enough. And on either side of the sulcus limitans, there's an area called vestibular area. Vestibular area because there are vestibular nuclei. Vestibular nuclei are connected to or related to the vestibulocochlear nerve. So it is seen in this area. So it's called vestibular area. So these are some of the things that you can see in this part. Again, the lower aspect where you can see the sulcus limitans, right? Sulcus limitans is joining here, right, to the median sulcus. Just a few centimeters above that, you can see that there is a line that is extending from sulcus limitans to the inferior cerebellar peduncle, and at that area there is a spot, there's a depression that's called inferior fovea, whereas here you saw superior fovea in this area. I think that will be fine. So it has a functional aspect as well that you may study in physiology. If not, you can ask me, I can explain in detail.